Okay, so you've done spirometry and your ratio is normal. Now what do? You still think your patient has COPD. Well, for starters, I would tell you don't stick to the guidelines or those gold numbers that are set hard and fast quite so rigidly. You need to look at the patient again. A clinical assessment is priceless. Secondly, I would say, well, let's make sure that we have good data. Did we meet end of test and did our flow plateau? Are our numbers hyperinflated? And then I would say, if that's not true and your patient did plateau flow, I would say, well, then you're not done yet. You still have a little investigating to do. The patient probably may have COPD, but you need to do a little further investigation. Does that obstruction, even though it's, remember, gold stage 1, FEV1 is 80 or above. That's considered normal, so we need to dive a little deeper. Let's look at some lung volumes to make sure that we're not missing a restrictive pattern here. And then we also need to look at maybe some DLCO. Is our ventilation or our gas exchange being affected? I hope that helps. It's a really hard question, but just know that if your ratio is still normal, your patient's symptomatic, you're not done yet.